Hi, everybody. This is Victoria from the Council on Aging. Today we have Ms. Aileen Lemoyne here from Mass College of Pharmacy, and we are here today to talk about depression, anxiety, and mindfulness. Good afternoon, Aileen.
Good afternoon. Hi. Hi, Victoria. And hi to everybody out there. Um, I'm happy to be here again and talking about something that is pretty relevant in this day and age, especially we've been talking a lot about mental health being the second wave of COVID. Is so many people have been going through so many different things that are out of the ordinary and have are struggling with some of this depression and anxiety. So we thought this would be a good topic to bring up. So just a little news, I'm from Massachusetts College of Pharmacy, our pharmacy outreach program. And we are a program that is free to anyone in the state of Massachusetts. We are funded by grants from the Executive Office of Elder Affairs, the City of Boston Age Strong Commission, Central Massachusetts Agency on Aging, and from Mass College of Pharmacy, the university itself. We have caseworkers who can help you with obtaining and affording your medication. And I am one of 3 pharmacists who can answer questions about your medications or do medication reviews or do things like this, go out to the community and try and spread some information about different disease topics and the medication and other ways you can handle and get through some of this. So currently, everybody's working from home. Um, we take turns with the phones, so you can call our toll-free line, the 866-633-1617. We're open Monday through Friday from 8:30 to 5. Typically, somebody's going to answer the phone. If you do get a voicemail, it's simply because whoever's in charge of phones is currently on the line, but we will call you back. You can also go to our website, the mcphs.edu/pharmacy outreach. On our website is the Ask the Pharmacist link, which if you fill that out, the email actually goes to everybody in the office, and we will address the questions. And we are staffed, as I said, by case managers and pharmacists. Come August, again, we will have pharmacy students who are in their final year of pharmacy school who are doing rotations, preparing to be out in the workforce. So they also will rotate through our program and they will attend some of the outreaches or under the supervision of a pharmacist, answer some medication questions. So what we do is we will answer questions about medications and disease states. We do one-on-one medication reviews because sometimes people get medications from a lot of different doctors, or they've been in the hospital and discharged and have things that they were on before they went into the hospital that they're now on different medications. We want to make sure to pull those out and only take the ones you're supposed to be taking. If you're having trouble affording a medication, we're going to look at ways to research and find out if there are programs or coupons or grants available to help you afford your medication. During open enrollment, we are all hands on deck for reviewing Medicare Part D plans. We want to do a personalized search for you. What plan may be really good for a friend of yours could be a horrible plan for you. So we want to make sure you are getting the best and most economical plan for you. And it's wonderful. We're not working for any one company, so we will evaluate all of the plans and see if maybe the plan you have right now will be a great plan for you next year, or maybe there are changes to the formulary and we may need to find something else out and find a new plan. And the last thing we do is go out into the community and do presentations like this. Both our caseworkers do presentations, and as on the pharmacy side, we do presentations also. And we enjoy getting to know people across the state of Massachusetts. So the first thing I just want to hit on is being careful to avoid over medicating and harmful drug reactions. So it's as you're taking your medications, we want you to, if you have a lot of prescription medications, keep that updated drug list, put it in your phone. I mean, you could put it in your phone in the notes section. You can put it in a piece of paper in your wallet. Just have that in case, suppose any kind of emergency happens. When I was working in a pharmacy and dispensing medication, we would often get calls from the emergency room asking for somebody's medication list, which is fine. And we never had a problem with it. The problem was for people who went into an emergency room when we were closed and they didn't have easy access to the medication list. And we want the hospital to be able to take care of you right away. We don't want to be putting any stops on your care because they don't know what medications you're on. Watching out for over-the-counter medications. Some over-the-counter medications don't work well with prescription medications. We can answer questions like that, as can the pharmacist in your neighborhood pharmacy. Don't be afraid to ask questions. Asking questions is really helpful, and making sure you are following the directions accurately. A few years ago, I had a man come to me and with a new prescription for his blood pressure medication. I asked him if he knew how he was going to take it, and he said, "Yes, I'm doubling it." And I agreed with him. He was doubling it. Come to find out, the prescription had been for 25 milligrams, it had gone to 50 milligrams. He thought doubling it meant take 2 tablets. So now he's quadrupled the medication. He was dizzy, he was lightheaded, suffering from severe vertigo. So it's making sure that it was something for me that taught me I need to be crystal clear in my what I'm saying about the medication. And so make sure you fully understand. Don't, if the medication is being doubled, does that mean I take 2 tablets, or does it mean you're giving me a prescription for a higher strength? And then report any problems to your doctor or your pharmacist to see if there's side effects, or maybe it's an allergy or an adverse reaction. It's always good to check those things. If possible, I know a lot of people are getting all of their maintenance medication, through a mail order pharmacy. If possible, use one pharmacy. Um, if you are having all of your maintenance medication filled at a mail order, and then all of a sudden you get prescribed, say something like an antibiotic or a cream or something for, a short period of time, just make sure with the doctor or the pharmacist that's filling it that it doesn't interact with anything you are already taking, which is again a good reason to have that medication list on hand. Double check the label. Make sure it's the right medication. Make sure you understand what it's say, how you're the directions and how you're supposed to take it. Before you leave the pharmacy, open up the bag. Take a look at the color of the tablets and make sure, it's the thing you're supposed to be taking. And a lot of times with generics, we're changing generic companies. So what may have been blue last month is orange this month, but it never hurts to just double check and make sure that's accurate. Don't take your medications in the dark. Um, you always need, even, I mean, sometimes in the middle of the night, I get a headache and I go out to the kitchen to get the medication. I open up my microwave just to have enough light to make sure I'm taking what I'm supposed to be taking. I had a patient once who had all of her medication on her night table, and she went to take her once a week methotrexate, and she was taking about 6 tablets of the methotrexate once a week, but instead she took 6 alprazolam. So it's very important to be sure of what you're taking, and don't take medications prescribed for somebody else. Um, Again, you need to make sure that that medication is going to work for you and work with your medications. So, one thing we were talking about is the medication checkup. It is recommended that you have a medication checkup once a year. And that's because if you're seeing multiple doctors or getting prescriptions filled at multiple places, or, it's just an important thing to run through it. I've had times where I would have a medication list and people were taking two medications in the same category of medication or the same family. And I asked them about it and they thought they were supposed to keep doing that. Instead, the doctor had said, instead of this medication, I want you to stop that one and take this one. So we want to make sure we don't want to have anything that could cause harm to you. Our biggest thing as a pharmacist, I learned in pharmacy school is do no harm. So we want to make sure you are getting everything and you're doing well with your medication. Your doctor, your pharmacist, somebody at pharmacy outreach, we can all do the medication checkup. And you want to make sure you're cleaning out your medication cabinet regularly. Get rid of everything that's expired or old or you don't take it anymore. Use drug take back days or throw medication in, throw pills or tablets or creams into like messy garbage, into coffee grounds or kitty litter. It just breaks it down and makes it unappealing to anybody. And it gets it out of the way. And it's not something that will affect the environment if you do it that way.
Yeah, and we do have a drug take back program here in the town of Berlin at the police station. You can drop off your medications. So just in case anybody needs that as well.
That's fantastic. So moving into the topic for the program is depression. So something I've been hearing more about from people who are struggling, um, that they're sad. Um, they can't get out of bed. So depression is something that is a persistent sadness. It affects how you feel, what you're thinking, how you're behaving. Those daily things that you used to do every day start to become a challenge. Um, it's not a weakness to suffer from depression. And especially now, we're going to be seeing a lot more in the way of depression and anxiety from people as we come out of this pandemic. Even next week, I'm doing a webinar with Boston Children's Hospital on the mental health of children as we move forward. So it's not a weakness. It's not something to be ashamed of or a stigma, but instead it's something to really take care of because your mental health is just as important as your physical health. So some of the symptoms of depression is, a decreased mood, you're sad, you have no interest in doing any of the activities you normally would do. Um, Changes in sleep. Maybe you want to sleep all the time, or it changes in appetite where you want to eat all the time or you don't want to eat at all. Low energy level, you have trouble concentrating, you're mad at yourself, you have bad self-esteem. You could have angry outburst with coworkers or family or something, and you don't understand why it happened. One thing with mental health that is really important is if you feel or you're thinking about hurting yourself or hurting somebody else, you need to get help. It's very important. We want you to be healthy. So call 911. There's the National Suicide Prevention Lifeline with the number here of 1-800-273-TALK or 8255. They can give immediate assistance if you're feeling like hurting yourself, and they can be somebody to reach right away and talk to. So with treatment of depression, it's not just medication. Medication is one piece of treating depression. It's therapy. It could be hospitalization. It is mindfulness. whether that's meditation or yoga or anything like that. It's a combination of what's going to help. It's not something like, I have an infection, I'm going to take an antibiotic, and in 2 weeks, I'm going to be better. It's a longer term care that's going to be needed. Um, and it's more than just your medication. It's going to be, a couple of different things to get you through. You may need to try several different medications, or it could be that you need to find the right combination of medications. I had somebody once come up to me and say, okay, I just started on this medicine. If it doesn't work, what's next? It's not necessarily like a straight line, like A to B to C. It's more what's right for you, what works for you. And another problem with antidepressants is they take a while to work. They're going to take at least a month before you're really starting to notice if it's working or not. And it could be something that you don't even realize it's working. It could be that just all of a sudden you're getting through a day easier and you just didn't realize it. So, sometimes it's so gradual you don't realize that it's actually helping you. So it's going to be something that you think about, like, was it as this hard to get through the day before, or am I doing better? And no matter what antidepressant medication you're on, just don't stop taking it. It's a medication that has to be weaned off of, and you need to do it under the advice and guidance of your doctor. So some of the side effects are nausea, loss of sexual desire, fatigue, insomnia, and they're opposites. Dry mouth, blurry vision, constipation, agitation, maybe some irritability. What a lot of people find is sometimes when they start the antidepressant, they're feeling these effects, but as the medication starts to work better, actually the side effects decrease. So it's kind of like a pathway. It's like the side effects or the medication is ramping up and the side effects are decreasing. So that happens with some of the medication. So if the side effects are just unbearable, definitely we want to look into something else. But if they're like that nagging type of thing, maybe give it a couple weeks and see how you're feeling. So moving from depression into anxiety, and we've all faced anxiety. I mean, you're getting ready to go to an important meeting and you can't find your keys, or your wallet's missing. Those are moments of anxiety, and you feel that, but there's a cause and an effect. So you've lost your keys, you're looking for your keys, you find your keys. So in that period, you've had all of this anxiety, but then it's this huge relief afterward that, okay, everything's good, I'm ready to go. But really, what anxiety disorders, the problem is that an it's anxiety when there's no real cause for it, or doesn't seem to be a real cause for it. It's ongoing. It can include panic attacks. It's difficult to control it. You can't control it. Um, if you're suffering a panic attack, you could be having the sweating and trouble breathing and racing heart, and you might feel like you're going to pass out. So that's when that type of an anxiety, that anxiety disorder, needs to be treated. It's way different than, I'm having anxiety in a short period of time, and then we figure out what's causing it, and now it's going away. So again, going through some of the symptoms is nervousness, restlessness, tension. You just have this ongoing sense of doom, like something terrible is going to happen. Your heart rate's increased. You're breathing rapidly, feeling like you're going to hyperventilate. You could be sweating, trembling, feel weak or tired. You can't concentrate on anything. You fall asleep, but you're up in the middle of the night worrying about something. Your stomach's all out of whack. Nothing's working there. And you just can't control that worry. we had one woman who came into our pharmacy a while ago feeling like she was having a heart attack. She couldn't catch her breath. Her heart was racing. She just, she felt like it was honestly a heart attack, and she asked us to call 911. Came to find out it was a panic attack, and she was incredibly embarrassed about it. But once she got help, the help and the care for it, then all of a sudden her outlook and her entire mood changed, which again, it's important to get help for this and not to be ashamed or feel stigmatized by it. So there are different classes of medication for anxiety. One class is called SSRIs, which are also antidepressants, but they're antidepressants with an anti-anxiety component, like the citalopram, escitalopram, or sertraline. They're probably medications. If you've been somebody dealing with depression or anxiety, these are common medications. They've been around for a while. They're generics. They're great help. Gabapentin may be something that's used, or one of the benzodiazepines like clonazepam or lorazepam. Um, but the clonazepam and lorazepam are recommended only in short-term use with anxiety. It's not something you want to be on for a long period of time. So if we're going back to like the panic attack, it just comes out of the blue. Your heart's racing. It could be either hot flashes or chills, sweating, numbness and tingling. You're trembling. You can't catch your breath. So the short term in it for a panic attack, we want a short term medication. We want to just kind of break that cycle of the attack. So that's where the benzodiazepam are useful, the clonazepam and the lorazepam. But we want to use it just, situational. Like right now, I'm having a panic attack. I'm going to take this medication within like a half an hour. I'm going to calm down. Everything's going to feel better. But we don't want it to be long term, particularly because long term use, um, not only is it something that you could get adjusted to or addicted to, there's also an increased fall risk with these medications. So we want to be very careful. We don't want anybody to have unnecessary falls. People who have been on it for a long term don't always realize that they are impaired from it. They don't always realize how foggy their brain may be. Especially as you age, you will process these and they stay in your body longer. So if you're taking it multiple times a day, the dose just builds up. And that's where you are particularly at risk for falls. So, whoops, excuse me. So mindfulness is one of the things that can help you. And you may go through a therapist for this. You may have like a yoga class you go to, but it's being fully aware of the world around you. And I was told by somebody I know that when they go through a panic attack, they are looking at what is 5 things around me that I can see. What are things around me that I can smell, that I can hear, that I can touch? And it's coming very much into the moment of where you are and what is happening around you to try and calm and break the cycle of what is going on inside of you. So it's just being fully present. So I can tell you, like, my window's open and I can hear somebody mowing their lawn. I can feel the breeze. I can smell the cut grass. So it's being just aware and feeling like you're fully in that moment. You're aware of what's going on around you, just so that to try and help you to relax and calm down, and to try to not overreact and become completely overwhelmed by the situation. So the benefits of meditation is it decreases stress, it decreases anxiety, it can help in pain situations, it can help in depression, trouble sleeping, and high blood pressure. So I just have a 1-minute meditation here. Like, oh, if I can get this to work. Oh, all right, I'm gonna try. Hmm. Hmm.
And body. Soften your face,
Can you see this?
your neck. And we'll take a few moments to calm your mind and body. Soften your face, your neck, and shoulders. Do your best to fully let go. And turn your attention to the breath, the calming breath, the soothing breath. Take long, slow breaths, full and deep. Breathing in, I am calm. Breathing out, I'm at peace.
Okay. So these are things that I found just on YouTube. So there are, easy access to different things that we can use to help ourselves. I mean, I also have my Fitbit, and there are times where I'm feeling really stressed. I can push the button and it starts a 2-minute relax section, and it kind of buzzes and like tells you when to take that deep breath and how to just slow your breathing. And really, I'm just amazed at how well it works. Um, I have found guided meditation is extremely helpful. One of my daughters has anxiety issues and frequent panic attacks, or she did. I'm happy to say she's gotten much better, but she had she has tried medication, but also what really truly helps her, especially in those moments when a panic attack, is the guided meditation, to just relax the stress that's in her body, to relax. You don't realize, like, you're pulling up your shoulders at this point. You want to just try and relax it. You want to, take those deep, slow, calm breaths. And it's amazing how some things like this can truly just help you, not only emotionally or stress wise, but also they affect you physically. They can bring down your blood pressure, your pulse, which may be skyrocketing because you're worried and you're anxious. You can slow that down. So it is a mix of different things to help you with depression and anxiety. It is more than just medication. Medication is definitely one of the pieces to the puzzle, but it's a piece. And we really have to make sure you have a complete package. Um, and if anybody has any questions or thoughts, you can always reach out. And I don't know, Victoria, if you have anything else to add.
Just please reach out to us if you have any questions as well. Here at the Council on Aging, we're more than willing to help you get, a list of providers or help connect you to the right services as well. As Aileen is saying, that, medication is a piece of the puzzle and that therapy can be another piece to it as well. And that just because you may need some help temporarily, it does not mean that this has to be what you need for the rest of your life. It could just be, a temporary thing, or it could be something that will last a while. But either way, please know that we understand that no one has come and asked, for these symptoms or these feelings. Like, we understand that, and that we want to make sure that we can do what we can to get you what you need. And that's what's prevalent and most important to us.
Completely agree. So that's all I have. If you have any questions for pharmacy outreach, you can reach us again at the number of 866-633-1617. And I am very grateful that Victoria has asked me back. It's always fun to be here and to share with you.